welcome to BizNews. I'm Elizabeth Lee. Tonight we're going to talk about telemedicine and how that actually works and serves the BOP or the bottom of the pyramid with our guest tonight, Hugh McClung, who is the CEO of MyDocNow, and also Dr. Mike Vergara, who is the Chief Medical Officer of MyDocNow. Telemedicine, that's kind of like trending a little bit. Can you define what telemedicine is first?
Essentially, it's a remote consulting between a patient and doctor. It can be text, it can be voice or video. Mm-hmm. It's traditionally been around for a long time in some form. I would say within the U.S., particularly in the last 2 or 3 years, there's been a significant uptick of interest in usage. Some of the large carriers providing this service in the U.S. have seen more sales, for example, last year than they have in the prior 8 years.
But telemedicine really is basically using your cell phone.
That's correct. Well, yes and no. Clearly, at one level, it's using your smartphone with a video consult, if you will.
Yes.
Or it can be just talking to someone on the phone. In the Philippines, we have 2 markets, which is the focus on the metro area, which we will deliver a video experience, and in the rural area, we'll deliver just talking on the cell phone experience, because, as you know, the internet experience here is not too good.
Yes, but the gist of it, because it's now trending. I mean, you mentioned to you that it's been there for maybe 4 years, but it's only trending now in recently because of the technology.
Yes, of course. Yes, of course. I think the world is going towards smartphone.
Yes.
There's some statistics that suggest in perhaps another 3 or 4 years, 60% of the doctor-patient experience will be on your smartphone. It clearly allows you not only to see a picture, but also take vital signs that go into your smartphone that go to the doctor. So that's where the world's going. Outside the hospital, onto the phone, and in certain environments, particularly the Philippines, where traffic and it takes maybe 5 to 6 hours to go in and see a doctor, this provides a nice, simple solution.
Yeah. Now, how does this work for you, Doc Mike? How does that work for you as a doctor?
Yes.
For patients that actually normally go to the hospital, to a clinic to see you.
Yes.
Now we're going to talk to you over our cell phones, over videos. How does that work for you as a doctor?
I've been a doctor for going 33 years.
33 years.
Yeah. And as soon as I finished my medicine at the UP College of Med, I went to the provinces. Okay. And at that time, in the 80s, the late 80s, if you want to help or serve the bottom of the pyramid, as you had mentioned, you had to go face to face. No other technology then could get you to face the patient. Okay, and I did this for 21 years. 21 years of my life. Yeah. I spent in
That's your personal CSR, no, Doc? That's your personal CSR,
Yes. Yes. And I came back to Manila for personal reasons. My mother got sick and all. I had to take care of her here. And since then, I stayed. Okay? And I left so many people. I left so many people in the field without doctors. Because I was in areas where they really didn't have any doctors.
Did you go to some of the far-flung areas?
Yeah,
like
5th class, 6th class, Bondok Peninsula, Negros Occidental. I stayed in an island in Masbate for 3 years. Not the main island, but the small island.
Yes.
Okay? And when I was in Manila, we got in touch through phones. Okay?
Yes.
They would call, they would text or call. Okay, Doc, what do I do?
Yeah.
My child has a fever. Do I have to go to the hospital or not? Just yesterday, I got a call from the Bondok Peninsula, Quezon, and the man was asking, my bunso or my youngest son got bitten by a dog. Do I bring him to the hospital to get tetanus shots and anti-rabies shots, which will cost about 6,000, 7,000, 8,000 pesos, and they don't have that kind of money.
Right.
And without the information that I gave, he would have had to probably sell a Carabao or something just to get the shot, which the boy did not need. Okay, at least not the not the rabies shot. No? See, the doctor can, or the health provider can actually give information vital, important to the person in the field. A farmer can get hurt while plowing the field and just call MyDocNow and we can tell him what to do.
Take a picture and say, Doc, I did something.
Yeah. Or just ask, what should I do? Now, do I give this medicine or that medicine? Or do I just put a hot pack or a cold pack?
Right.
That makes a big difference in the lives of the people, economically and health-wise. Okay? You know very well that one of the main reasons of poverty in the Philippines is chronic disease.
Yes.
They end up having to sell their land, quit their jobs maybe or something that way. And we're here to help. Okay, we're just a phone call away. In the Philippines, in Filipino culture, families always say, "Sana we had a doctor in the family," or "Sana we had a lawyer in the family."
Right.
But most of the time, it's "Sana we had a doctor in the family to call." We're here.
But we have nurses in the family.
That's true. That's true. But now we offer that. Now we offer that relationship to the people. You can call us.
How did MyDocNow come about? I know this is actually available in other countries like the United States.
Yeah.
Now, how did it start here?
Essentially, I had a partner in Hong Kong, Graham Player, Australian, also in traditional Chinese medicine, and we decided to take advantage of technology and looked at things we might do and decided that this clearly telemedicine was a good platform with the smartphone. Also recognizing that the trend in healthcare is moving outside the hospital towards the home, whether also in the U.S. and less so here, aging populations, they want to be at home and have some experience with a doctor at home. So we recognize that there would be a interesting market niche here to serve people that want to save money, be more and more convenient. In the Philippines, it's not so much saving money. Our prices would be, I think, somewhat the same for actual physical consult with a doctor, but it's the convenience. On average, 2 to 3 hours to get to your primary care doctor. You go into a hospital, you wait for screening, maybe a 6-hour experience. Where now, it literally takes 3 presses of a button, and you'll see a doctor, and not only that, the doctor will prescribe a medicine for you, and we will deliver the medicine to your home or office, wherever you are.
So you also have logistics to do that?
Well, we have a company called MedExpress we're working with, and they have
a local company?
Yes, a Philippine company that will deliver medicines, and our nurses will contact them, and they arrange to get it to your home.
All right, we're going to continue this discussion. We'll be right back. You're watching BizNews.